Hello everyone. So today first we are going to learn about stage 5 of spina bifida treatment. It is primary school through the adolescence. So first of all, what are the goal of this stage? First is confirm the functional motor level and re-evaluate ambulation potential. So as child have growth spurt, there might be chances of stagnancy or deterioration in their prognosis. So you have to reevaluate their ambulatory skills and try to maintain the present level of functioning. Which means if child is walking with walker, your goal for treatment is to at least maintain that function for the child. Now next, promote the independence in self-care skills. So child is growing up, so your goal should be directed towards the making them independence for their ADS. Then promote self-esteem and social adjustment, as these age is vulnerable for any child. They may face peer pressure, they want to be accepted and wanted to be get involved with others, right? So but it is more difficult for a special kid. Child with spina bifida may get rejections and or feeling left out. So you have to teach them how to cope with the situation and boost their self-esteem. Also, you have to continue with strengthening exercise, stretching and positioning exercise as per the individual child requirement, as we discussed in previous videos. Now, ambulation. So, ambulation of child depends on uh, ambulation might be difficult due to growth spurt. Strength does not increase in same proportion as the body weight. So child has growth spurt, because of which their height and weight increase, but the strength of the muscle in lower limb does not increase with the proportion. So muscle can't tolerate the body's weight and child can't able to walk further. Next is level of lesion. Child with thoracic lesion have difficulties in ambulation. On the other hand, uh, lesion at the sacral level, they can have very little difficulties in walking. They can walk independently, right? Now, next is muscle power. So, particularly extensors of lower limb. Then degree of orthopedic deformity. So if child is having contracture or any deformity, he will have difficulties in walking. So these deformities hampering for the child's ambulatory capacity. Okay. Then and height and weight of the child. So as I mentioned earlier, it might be difficult for the child with growth spur. Locomotion. So in previous stages, you taught child how to walk. Now in this stage, child can walk, but you have to uh, teach them gait related all these skills, such as if child fell down, then how to reach towards the crutches or walker and how to get up, right? Then also ambulation of different terrains such as grass or uneven surface, and lastly stair climbing. Now if child is non-ambulatory, choose wheelchair according to child's need, right? So as most of the time they spend sitting on wheelchair, here are some skincare for the wheelchair users. So they have to inspect their skin using a mirror twice a day to check for any signs of skin breakdowns or bad sores. You can also advise foam or air cell cushioning for the weight distribution, right? Then teach the child weight relief techniques such as weight transfer techniques if they are sitting for the prolonged time to prevent the decubitus ulcer, and clothing should not be restricting, so clothes must be relaxed. Orthosis, so to prevent the spinal deformity, so such as scoliosis, you can use thoracolumbar sacral orthosis. Now, orthopedic deformities. If child has developed any contracture or deformity which is hampering for their prognosis, so it requires surgical interventions, right? Such as muscle release or sectioning of the tight contracted muscles, such as uh, iliopsoas adductor or hamstring. So, post-operative physiotherapy includes strengthening and gait training for the particular muscles and lower limb. Functional independence. So, plan your exercise according to child's daily activity to make them independent, such as self-care skills, dressing, food preparation, eating, and social interaction. Help child to relate exercise to functional independence. In other words, treatment plans should be directed towards the achieving the functional goal, right? So for instance, if child's functional goal is to preparing food, okay, so they need stable trunk and good strength in the upper limb and scapular muscle. So you have to plan treatment accordingly, okay. And it is also important to not only focus on lower limb but uh, upper limb also, because to make the child functionally independent. Foster social and recreational independence by adaptive sports and fitness program and leisure activity. As I explained previously, child faces social rejections, right? Therefore, you need to teach them how to be socially independent, okay, and socially active. So, you can achieve it by adding leisure activity or sports program in their treatment protocol. So, which will also helpful to increase strength, endurance, and boost their self-esteem, right? Activities such as swimming, tennis, basketball, and bowling. Uh, Here are some photographs showing some sports activity such as karate and volleyball, tennis, racing. Okay. Nowadays, Paralympic sports encourage many special children, which will also help them to financial independence. So encourage your patients to involve in such activity which will help them physically as well as financially. Now, perceptual and cognitive training. Mostly child associated neurological condition have impaired perception and cognition. First, you have to screen the child for any impairment. If they have any impairment, uh, first you have to follow the remedial program and you can use sensor integration technique. Okay. Also some behavioral modification and cognitive training activities as well. And sometimes child require psychological support, so provide when it requires. Now we are moving towards the last stage of the ambulatory phase, and it is transition to adulthood. So almost 85% of spina bifida patients reaches towards the adulthood. Now let's look at goals for the patient. So previously we taught patient locomotion and functional independence. Now in this stage, being adult, uh, person has some responsibilities such as self-care, household management, and financial responsibility. Right? They require independent mobility such as driving and accessibility to community for the leisure and recreation, or might be therapeutic purpose. Okay. There are various vocational training centers and various spina bifida groups at state or national level, which will uh, help them to develop vocational skills and be financially independent. Okay, so you can recommend one of these group to your patients. Then maintaining social relationship is also important. So long-term partnership with friends or business contacts or other professional in their day-to-day life. Other goals are reducing mortality and morbidity. So it is essential for patient to be active at this stage, because inactivity may lead to morbidity and dependency on the others, which eventually lead to mortality. Okay, therefore always motivate your patients for the exercise or being active, whichever sports or activities they like. Okay, now enhance general health. So with aging, musculoskeletal strength will reduce and reduce further. So you have to increase musculoskeletal range and maintain the patients. Now, what are the problem lists for the adult with the spina bifida? So deteriorating general health, renal, respiratory, cardiac complications. So renal complication due to maybe neurogenic bladder, then respiratory and cardiac complication due to sedentary lifestyle or secondary to the renal complication. Right? Now, as we previously discussed, child with spina bifida mostly have osteoporosis, and as the age increases there will be uh, increased chance of osteoporosis. So due to osteoporosis, decreased strength and general health, and minimum weight bearing, increased risk of fracture. Then muscular pain in upper limb due to the overuse of crutches or wheelchair. Next, degenerative changes. Uh, Knee pain. Knee pain might be due to degenerative changes or due to the abnormal stress placed on the knee due to weak hip. Then obesity. So patient who cannot walk or do not go for the endurance or aerobic exercise lead to sedentary lifestyle, and which lead to obesity. Secondary complication of obesity like hypertension, heart disease, or the diabetes. Next is decreased skin integrity. So patient have thin and less elastic skin, poor tissue perfusion, then absence of perspiration and incontinence. So if child do not follow the proper skincare technique and weight relief technique, there is high chances of having decubitus also. And if this will not get proper medical and personal care, it may lead to the wound infection and which sometimes be life threatening. Okay, guys, now we are completed physiotherapy treatment for spina bifida. And if you have any queries, you can write in the comment section below. And please like the video. And in next video, we are going to talk about the orthosis management for the spina bifida.